the first question that we had that somebody asked us to answer was about varicose veins, really bothersome varicose veins, especially in the labia. And so I thought I would go through a little risk analysis of this situation. So if you are taking care of somebody who either shares that they have varicose veins or you identify them on exam, it's really important to take stock of where they are on the body and the degree of severity. And so it's not so much the color. Varicose veins can be quite black and blue, or even kind of spidery veins, red, but it's about how big they are. And so if the vessel looks like it is bigger than your pinky finger, you have something that you really need to pay attention to. And oftentimes what happens with varicosities is that they come in groups. So there would be like a collection of like 5 or 6 veins that kind of turn into a knot in one area. And that could happen anywhere on their legs. Rarely it can happen on the arms. And then of course it can happen in the labia or genitalia. And so the big worry is that if we have a varicosity on the labia when we are pushing a baby out, it might rupture that vessel. And then there would be excessive bleeding that would be very hard to stop. And that is a real risk. It can be, obviously, we can mitigate that risk by good counter pressure, compression garments during pregnancy, and actual counter pressure with, an oil-soaked gauze pad during the pushing phase. But it's definitely something to consider. And there are some midwives that would take a look at various varicosities and decide, actually, this gal needs to birth in the hospital because of this risk. If you do take that risk, it's very important that you communicate that with your client. It's very important that they are making that risk decision-making process with you. If you haven't yet, check out Hermine Hayes-Klein with her excellent lecture on informed consent that we posted yesterday. We really need to be getting full consent for any procedure, including giving risk-benefit alternatives. So when we have a varicosity in the labia that has already been well established, we're unlikely to reduce its size during pregnancy. The most we can hope for is helping it not grow. So compression stockings can be helpful. I'm a really big fan of the supplement rutin. High bioflavonoids, high vitamin C. Really, you can take as much vitamin C as you can tolerate. So bowel tolerance is the only downside to vitamin C. So if you're noticing loose bowels, that's the edge of comfort. But the more that you take, the more you can kind of move that comfort out. And there's a lot of research by Linus Pauling at OHSU about the incredible safety of vitamin C in mega doses. We're talking like 10, 15, 20 grams a day. And that it's really helpful for vessel wall strength, as well as all your B vitamins and the rutin, which I think is really helpful. And even though compression stockings are real uncomfortable, that can be a huge benefit.